Viewpoint.
Good morning. I'm Pat Lawson Muse. It's a cruel, destructive disease that's diagnosed every 66 seconds in this country. More than 5 million Americans are living with Alzheimer's disease, the most common form of dementia. And the numbers are growing fast. It's now the 6th leading cause of death in the U.S., claiming more lives than breast and prostate cancer combined. June is Alzheimer's and Brain Awareness Month, so we take a look this morning at this disease and other forms of dementia. Years ago, dementia struck the wife of Prince George's County Executive Rushern, who joins us this morning to share his story. Thank you so much for being here.
Thank you for having me, Pat.
First off, how is your wife, Krista, who has been suffering dementia and was diagnosed several years ago?
She's doing better. We're in a good place. Our son just got married. We had a graduation of our youngest child, and while she couldn't go to the graduation, she knows about him, and so she's doing better. Thank you for asking.
Yes, and then the family has had to rally and deal with a situation that you were not prepared for. Tell us when you first realized that something was happening to your wife.
Well, probably when she was about 48. She was 48. She had just stopped working and was looking for a new job. And the thing that struck us was that I was away on a business trip, and she had taken our daughters to Richmond, where she's from, to visit her parents. And my daughter called me and said, "Daddy, we're lost." I said, "Well, your mom needs directional challenge." I said, "Well, where are you?" She said, "We're around the corner from Nana's house, but Mommy doesn't know how to get there, and she's crying." And I said, "Okay, well, see if you can help her get to the highway and get back to our house." Well, that led me to coming home and saying, we need to take you in to see something. But she was like, nothing's wrong with me. And for 2 years, I would take her back to the doctors to have her checked up. Finally, in about 2010, she was diagnosed with early onset dementia. Alzheimer's is what he told us. And that was it. He announced, he said, "This is what you had." There was no cure, and he sent us home. And that started a new process for our life. I was about to run for county executive. I was in the midst of announcing that, and then our life completely changed.
How did she respond?
She responded because when they did the test, as they normally do, I would take her in, and they asked her our kids' names, and she would be offended they would ask them, but she would tell them the names. And then the doctor asked her their birthdays, and she couldn't remember them. And she started crying, and I started crying. And then he started talking to me and saying, "Here are the things." And the thing about it, as soon as we left the doctor's office and we were in the car, she didn't remember that she had had the conversation with the doctor. And from that point on, she just knew that, we did things like saying, "Well, I don't want you to drive anymore. I want to be able to take you around. You've earned that right." But we completely changed. And for her, she didn't remember any of the incident with the doctor.
How much did you know about dementia and Alzheimer's before this happened?
Absolutely nothing. Nothing. I wasn't prepared at all for it, and this is one of the reasons we got involved. Financially, my wife did everything. She bought our houses, our cars, my clothes, the kids' clothes. She handled everything, yes. All the finances. I didn't know anything about, Alzheimer's. What helped me was my wife had causes that she, had causes that she believed in. And the Alzheimer's Association was one of those, just by chance. And she would give them money, they would send us brochures, and I happened to pick up one of their brochures, but no clue as to what to do.
Your children, you have three?
Three, yes.
How did they handle it?
You know what, they each handled it in their own way, but they handled it marvelously, much better than I did. I mean, I was in denial probably for the first year that it was going on. Our youngest, was really the best, Quincy, because she spent the most time at the stage where my wife was diagnosed. She was the only one left in the house. And but they all handled it much better than I did. I just tried to think that, something would happen and she would just all of a sudden snap out of it. And they dealt with it the way adults should deal with it, and that is, here's where we are, how do we deal with the situation, how do we make it better for the family?
All right. Prince George's County Executive Rushern Baker. We'll continue our talk right after this. We're talking this morning with Rushern Baker. You are a public figure, and you went public with a very private issue. Tell us, how you got there.
About a year into being county executive, it was clear that my wife wasn't going to be able to do a lot of the public things she had been doing before. The disease had progressed a lot faster than we expected. And so the kids and I got together and we had to make a decision whether we were going to say something publicly or say this is a private matter to handle it. I have to admit that I wanted to keep it private. And the kids came and they said, you know what, we can't advocate for change if we don't tell people what mommy has. And we're not ashamed of mommy. She didn't do anything. This is something, and you're in a position where you could help others. And then that's when we went public, and I'm glad we did. It changed our lives, and I think it changed the lives of people in the county, and allowed us to do the advocacy work that we want to do.
And in fact, you are being an advocate, and you even we have video to prove your advocacy. You all got tattoos. Tell us about this.
We all got tattoos. Our girls thought of that. They said, when we were trying to raise money for the Alzheimer's Association, so the girls said, well, what if they raise enough money, and I think it was like $20,000, that we all get tattoos. And my son and I, of course, were afraid. But we said as a family, we're going to do it for raising awareness and raising resources for it. And so we did it.
Here are pictures of Krista, your beautiful wife.
Yes.
And the tattoos that you got in her honor are the symbols of the Alzheimer's Association.
The symbols of the
and
Alzheimer's.
Her initials.
And her initials. So I have them right here, so you can't miss it.
Yeah.
But I thought it was appropriate. Our youngest child said, our oldest daughter, Asia, said when she was getting a tattoo, they said, well, this is going to be permanent. And she said, that's appropriate because the effect that Alzheimer's has on you is permanent. So I want something that symbolizes mommy permanently. And I thought that was the best quote ever. And so appropriate for what we're trying to do.
And what are you doing in Prince George's County?
We're having one of the most successful walks we've had in the past. It's even bigger now this year. In fact, we moved from Bowie Bay Sox Stadium to National Harbor because the awareness and growth and generosity of people in Prince George's County has grown since this has started. So we're very pleased with the advocacy work that's going on.
What would your advice be to someone who's watching this morning and learning about your story, who may be going through the same thing?
I would say seek help. Don't be afraid to let others help you. I was afraid in the very beginning. I wanted to do it myself with my youngest child and I, but seek help, take their advice. The Alzheimer's Association and other dementia associations are great resources when you're going through trials and tribulations. There are many a times during the process with my wife that I would go online with the Alzheimer's Association and learn how to brush her teeth. Something as simple as those things you could find out from others who've gone through it. And lastly, support group, whether it's your church, whether it's people or friends, but you need a support group. And talk to your family constantly.
All right. Thank you so much for talking to us and sharing your story. I know it hasn't been easy for you, and many of your colleagues and many of those watching know Krista, yes, and love her, and are wishing you both well.
Thank you so much, Pat.
All right. Thank you. County Executive Rushern Baker joining us this morning. And up next, the facts about Alzheimer's, the warning signs, and where to turn for help. We'll be right back. Welcome back. We want to talk now more specifically about Alzheimer's disease and dementia, the facts and the impact. Joining me now are Brigid Reynolds, who is clinical coordinator of memory disorders, the Memory Disorders Program at Georgetown University Medical Center. Chris Broulliere is president of the Alzheimer's Association of the National Capital Area, and Anna Nelson is vice president of programs and services. Thank you all for being with us. Chris, what is your focus going to be this month?
Well, June is Alzheimer's Brain Awareness Month, and that is a big month for us. So we're going purple. Got my purple tie on, And it's a time for us to promote Alzheimer's awareness and to raise money with our special fundraising day, which we call the longest day. And it refers to the summer solstice, which is the longest day of the year. So we think that people who have Alzheimer's live with, and their caregivers, they live with Alzheimer's 25 hours a day and 366 days a year. So in a lot of ways, people who live with Alzheimer's and their caregivers have a long day.
Yeah.
And so we think about the longest day as a time to raise awareness and raise money. And people get involved with the longest day. They can bake all day. They can play bridge all day. They can go for a bike ride all day. My wife and I are going to go for a hike all day to raise awareness and to raise money.
Yes, for research, which we know is needed. Anna, earlier in the program, we talked about Alzheimer's as the most common form of dementia. Is it true that everyone who has dementia has Alzheimer's, but not everyone? Not everyone who has dementia has Alzheimer's, but everyone who has Alzheimer's has dementia.
Yes, that is true, and there's a lot of confusion. The terms are used interchangeably, but there is a difference. Dementia is not a term that is used to refer to a disease, but rather to a collection of symptoms of a number of illnesses. So the problems with memory, the gradual memory loss, all these are symptoms, the dementia symptoms. And a number of illnesses, diseases cause these symptoms. So Alzheimer's is the most common form of dementia, accounting for somewhere between 60 and 80% of all the dementias. But there's many other kinds of dementia. They all have their own makeup. How their progression is different. Their diagnosis is different. Their pathology is different. So it's very important that someone be diagnosed properly. And there's also conditions that can cause lapses in memory as well. So I always tell folks, if you're worried, make an appointment to get a complete physical.
Brigid, I remember when my mother began misplacing keys and burning pans on the stove, and when she stopped making her bed. She subsequently had a hemorrhagic stroke, but she experienced a lot of the symptoms that you're describing, and then the doctor did say she is also suffering from dementia. Can you explain how dementia presents itself? And there's so many people suffering from symptoms like those. They don't all have Alzheimer's.
So different forms of dementia may present differently, and that's actually one of the important clues when doing an evaluation for someone with dementia symptoms. What was the first symptom noticed? What were other symptoms? And how have they progressed over time?
And is Alzheimer's always fatal?
Alzheimer's is considered a fatal disease, and so often will ask, well, how do you die from Alzheimer's disease? Well, Alzheimer's disease robs people of their function, and often they may fall and then get a hip fracture and then be in bed as a result of the fracture, and it's those series of things that lead to death.
And it also happens and develops in stages, is that correct?
Yes, people progress from early stages to a late stage, and people could progress over a few years. My mother-in-law had Alzheimer's, and she lived for 11 years after she was diagnosed.
So there's no set number of years.
I've heard anywhere from 10 to 15 years sometimes people will live.
Since the year 2000, the CDC says deaths from Alzheimer's have jumped by 89%. That's just mind-boggling. Can you explain that kind of increase, those numbers?
Right. Well, the population is aging, and age is the greatest risk factor for the disease. So every day, 10,000 Americans turn 65, putting them on a higher risk for developing Alzheimer's. And that's the main risk factor for the disease. There are a very small percentage of folks that have the very rare form of Alzheimer's called familial Alzheimer's. But outside of that, of the 5.5 million Americans who are diagnosed with Alzheimer's, the majority of them, there is no genetic connection. There are risk genes that have been associated, but not genetic connection.
All right, we've got to take a break. We'll continue talking about Alzheimer's right after this. Welcome back. Anna and Brigid, tell us what it's like to care for an Alzheimer's patient and what the caregiver needs to know. I also know it's very difficult on the caregiver.
It is extremely, it takes a tremendous toll on the caregiver. Our Alzheimer's Association just recently conducted a survey to look at the impact that Alzheimer's has on family caregivers, and 91% of them say they're doing it alone. That's unbelievable, because caring for someone with any form of dementia is really 24 hours a day.
Sure.
And without the support, it can take a toll on the person's health. If they're working, some of them actually have to stop work because they just can't do it all. It can take a total stress on their relationships with families as well.
Where do they go for help?
They can come to the Alzheimer's Association. One of the things that we do know is that once the diagnosis is made, families really don't know where to turn to. A call to the 800 number, which is 1-800-272-3900, can connect families to all kinds of community resources. And what we like to do is we like to start with a care consultation with families. These are opportunities to start the conversation. A lot of times families will say, we haven't even told our children. How do we have that conversation? So we address, depending on where the loved one is, we address what needs to be done. Planning ahead is key. We know caring for someone is very expensive, so we offer a number of community presentations on legal and financial planning to help families plan for the future care of their loved ones.
Brigid, what's the latest on research? We don't yet know what causes Alzheimer's, but there's some very interesting research taking place.
I believe the most exciting area of research now is that prevention trials are underway. So we don't know how to cure Alzheimer's disease, and all of our clinical trials have been negative to date. But we've learned so much, and this has paved the way for us to begin to look at, if we understand what's happening, and if we can target that underlying pathology years before the onset of memory loss symptoms, then perhaps we can prevent the onset of memory loss in people who are at greatest risk.
And can we just review again the main symptoms, the symptoms that people should look out for?
So memory loss in Alzheimer's disease is the most common, it's the earliest symptom. And so then that memory loss is things like not being able to find keys, but not being able to remember where to look to find them, because everybody has the opportunity that they can't find their keys. So memory loss, repetitiveness, so people telling the same stories over and over again, having difficulty following directions that were once familiar to them. Those are some of the early symptoms that might be recognized.
Okay, Chris, the Prince George's County Executive will be taking part in a walk that actually happens in Prince George's County later this month.
We have walks all over the metro area, and in Prince George's we'll be at National Harbor in the last Saturday in September, and Mr. Baker will be there with his family. He's very involved with the association and the walk in Prince George's County, and it'll be a lot of fun. A new venue this year at National Harbor.
Mm-hmm. And then there's the 21st, the longest day. And you talked earlier about how people can get involved and what they can do on this day to promote awareness and to help to raise funds.
The quickest thing is that our website is alz.org/thelongestday. And people do whatever is fun for them. They do it as a fundraiser, and they can do their own thing.
Anna and Brigid, what do you feel is the most important thing for someone who may be watching now, who is either going through this now or who may be about to go through this? What's the most important thing that you can say to them? What do they need to know?
For family caregivers, I think is, because I see this a lot, is that primary caregiver is owning more and more of the relationship. Initially, not much, because the family member just needs a little bit of help, but as they progress, the family member is doing more and more of the work, not realizing that it's taking a toll on their overall health. And so they need to understand that the real strength really is in knowing your limits, and that it's okay to ask for help, and that's where the association can help them with.
Okay, and is there medication that's making it easier to live with, Brigid?
There are medications that help to alleviate the symptoms of memory loss. There are not medications that target the underlying problem of what we call the tangles and plaques directly, but we're working on that very aggressively in research and hope to one day find a treatment that will halt or slow progressive decline in Alzheimer's disease.
A lot of work to do.
Yes.
But hopefully you've provided some hope for those who are watching this morning. Thank you so much, Anna Nelson, Chris Broulliere, and Brigid Reynolds. And thank you for being with us. That's Viewpoint. You can get more information about this program and any topic on Viewpoint by logging on to the NBC Washington website and searching Community. I'm Pat Lawson Muse. News for Today is next.